I would now like to introduce Tanya LaChapelle, BBF's Family Leadership Manager, who has been instrumental in developing this panel. Tanya?
Thank you, Dora. I'm very grateful to be here introducing our panelists. Their unique perspectives of the child welfare system will connect the data and our understanding to lived experiences. First, we'll hear from youth leader Mercedes King. Next, you'll hear from Lauren Higby, Deputy Advocate at the Office of the Child, Youth, and Family. And then lastly, we will turn to Lindsay Barron, Director of Policy and Planning for the State of Vermont's Department for Children and Families, Family Services Division. So first, I'm going to fully introduce Mercedes King. Mercedes is a child welfare advocate looking to make positive change by sharing her experiences and giving advice and expertise to those that are willing to listen and learn. She is a youth leader at the Youth Development Program, as well as a board member at Vermont's Office of the Child, Youth, and Family Advocate, and a board member at Northeast Family Institute. With that, I'm going to turn it over to Mercedes, and she's going to tell us a little bit more about her relationship with the child welfare system, what she thinks is really working well for families, and what she thinks is key for the legislature to understand about supporting children and families in the child welfare system. All right, Mercedes.
Hello. I'm Mercedes. I had a slideshow. If I can share my screen, is that possible? I think maybe. It's only just like a guide to follow, but okay, awesome.
You should be able to. Do
Let's
you see
see.
this share screen option, Mercedes?
Yeah, me. Awesome. Let me know if you guys can see that.
Yep, looks good. You got it.
Okay, awesome. It's still loading on my end. Okay, there we go. All right. So yeah, basically, I was already introduced. I'm Mercedes King. I'm an advocate for child welfare in the state of Vermont. I'm with the OCYFA. I'm also with NF5 Vermont, Northeastern Family Institute, and I'm a youth leader for the Youth Advisory Board through the Youth Development Program. I went into system at about 7 years old, which was in like 2011, and I was adopted, and then I was put back into custody, and then I aged out. I dealt with a ton of hardship within the system, including religious discrimination, taken off of false precedences, abuse in foster homes, programs, and facilities, and I've experienced extreme trauma because of the decisions DCF made for me. I became an advocate at 18 because I don't wish what I went through on anyone. So, and that's kind of just been my mission the last couple of years. It's been advocating for the people that need it most. But even though I was, in the system when I was also, in my adolescent years, I'm mostly focusing on when I was a kid and kind of what helped and what didn't. So, so I have resources, the things that are, I think, going well for children and families currently. I would say one of the most helpful things for me was I love NFI. That's the reason I work for NFI. They have some amazing community resources, and I loved their wraparound services program. So basically, they took me to do fun things like in the community. Like I used to go like rock climbing and swimming and like all this fun stuff. Like I had a worker, and then they would come into the home once a week and like discuss, like it was like an hour to like couple hour meeting of like what was going well for everyone in the family, what wasn't. And it was a very supportive space. It was very clear, and it just felt like the communication was there, and it just was like good, I guess, as a younger kid to feel like it was just a very supportive and safe space. And I thought it was a great resource. And I think obviously, I mean, the health insurance with DCF is great. That was another one of my key points is I've never had to pay for anything, and I don't until I'm like 26. And honestly, like that is such a relief, and it's been a relief for, me and my past families. So I'm extremely grateful for that. Next, I have some changes I'd like to share within the system. While there's a lot that I could say on this, I think I chose some key points to touch upon. Firstly, I think DCF visits should be more frequent and spontaneous. It's very hard to like fake or quickly clean things up or feed kids and clothe them properly when the visits are like frequent and spontaneous. Um, I guess my goal with putting that out there is, the house should be clean and up to code and, have food, decent clothing, and it should be a safe, nurturing environment at all times, not just, when somebody's coming, right? Um, and I think workers need to have in-depth conversation with the child and parent or parents separately and together so that nobody's able feels like they have to hold back what they're saying and there's no room for like misconstrued information. I think all of this stuff's like important in making sure like a child's living environment's actually safe and that everybody's safe and happy. I believe that also the DCF stipend that goes to foster families needs to be regulated more. I've experienced like malnourishment and not having proper clothing and such to make a profit off of my stipend along with my other siblings. I think that also DCF workers should have to document their like day to day kind of in detail and like more than, and I know we talked about the data system and I think definitely when that's in play that'll be a lot easier for clear communication across the board. But anyways, and I think workers should be getting like a second or a third decision or even having to go to their supervisors about important decisions, like making crucial decisions for a child's case. um just because any little, any big decision, I guess, can needs more than one opinion. Um, and I also think that I I wanted to highlight the fact that I feel like judges are appointed by DCF themselves, and I don't think that should be. I think that judges should be outside of DCF. I think that they should not be appointed by DCF. Because I actually went on WCAX this past year because I was taken off of false precedences because of lies in court, which was kind of thought to believe that it had something to do with judges being appointed by DCF themselves. Um, like they completely like switched my mom's file with another woman's and just changed the name to try to get us kids taken and stuff, and it was just a bunch of stuff that like it just felt icky and kind of like very much in their control, and not in a good way. And so I feel like when it comes to this decision of like legal matters, like DCF shouldn't be allowed to appoint judges like within their little system and bubble. Um, and obviously, I feel like there's not enough transparency and clear communication throughout the system, and it directly harms the outcome of too many children's lives. Which obviously, going back to the data system thing, hopefully that'll be helpful in the future for that too. So, yeah, I guess that kind of concludes my presentation. I don't know. I think we do questions at the end, but
Yes, we'll do questions at
yeah,
the end. Thank you,
yes,
Mercedes, for in a
awesome.
very short speaking time, giving us so many specific examples and ideas. We really appreciate that. Thank you. All right, next we're going to turn to Lauren Higby, who is the Deputy Advocate of Vermont's Office of the Child, Youth, and Family Advocate. OCYFA. She joined OCYFA in her current role after the office began in 2023. Prior to that, she worked for the Department of Children and Families, Residential Licensing and Special Investigations Unit, where she licensed, regulated, and investigated residential treatment programs, adoption agencies, and youth shelters. She transitioned to that role after seeing two runaway and homeless youth shelters and supporting young people transitioning out of foster care in Southern Vermont. She's held various roles in child welfare system in both Philadelphia and Chicago jurisdictions before returning home to Vermont. So Lauren will give you the floor to so that you can tell us about your role and what you think is working well for children and families, as well as what's key for all of us to know.
Wonderful. Thank you, Tanya. Hi, everyone. Can everyone hear me? Just to check. I see nods. Good. Like Tanya said, feel like it's important to start. I'm from Vermont, even though I had to leave and come back. From a farming family in Addison County, and have a bit of lived experience that's relevant to this work. I knew the Department for Children and Families, or DCF, when it was SRS, or Social Rehabilitation Services, I think. And there are multiple struggles within my family of substance use, domestic violence, and we were unhoused at different points in a tent and doubled up with family members. We accessed concrete supports for our basic needs like food stamps and TANF. And my mom worked her way through her undergrad career to become a teacher while on assistance. And I'd say my biggest protective factors as a child were, the really strong network of kinship support that I had, that we could access multiple family members flexibly and at different times. And then there were the concrete economic supports that I just listed. And so I'm currently a deputy advocate at the Office of the Child, Youth, and Family Advocate. And Tanya explained my whole trajectory through that time, so I won't I won't duplicate that. But really, it was starting my master's of social work degree in Chicago, and I just like randomly chose this internship at a foster care agency, and it was done. My fate was sealed, as they would say. And then I think another important part that wasn't touched on, I think one of my favorite career points was in Philadelphia when I was able to create a foster care crisis program that was helping foster parents and kinship providers have 24/7 access to a human, a direct human, for support, whether that was transportation needs or go bail a kid out of Kmart when they had retail theft. That was a fun one. But that was really important for the recruitment and retention of foster parents at our small agency. And to think about, to transition now to Vermont and child welfare right now, thinking what's working well, I'm going to try not to duplicate again what Dora has said, or even Mercedes and others. But I think is really important to talk about this point in time for child welfare is that we have, as Dora said, 907 children and youth in DCF custody, which is the lowest it's been in years, right? So that is exciting to me in that the work that DCF and others and the whole system is doing, it is starting to move that dial. And that is important, right? That's the hope we're going to hold on to when we think of other changes to enact and to recommend. I think that number is also backed up by the number of unique child victims is also low and decreasing, and that's mirroring national trends, right? So this collective work that we're doing is starting to show in the data, which I always think is very exciting. Other things that are going well, I think were highlighted, and even Mercedes mentioned it, our ability to access Medicaid and Medicaid dollars, right? Vermont is able to do so. There are ways to expand that, but there are some concrete supports in times of need with TANF or a child-only grant for kinship providers. I really appreciate that DCF is dedicated to a new kinship rule to support kin caregivers and potentially provide economic supports to kin caregivers that aren't licensed. Um, those are some really exciting opportunities and developments coming down. And then I also want to recognize DCF has been communicating with OCYFA regularly and answering our data requests and having regular meetings. And there's another interesting turn of events where we're starting to meet with technical assistance and KC family programs together. And so that coordination of efforts, I think, is a really fun opportunity and shows the positive direction that hopefully we can continue to move in. Um, and then for the next transition of topic of what is key for legislators to know, um, and I really appreciated the phrasing of this because I think our families, the children involved in the child welfare system, like Mercedes, like already know what changes we need and where we need the system to go. Um, and so, what I think is key for legislators to know about child welfare in general is that continuous reform, continuous child welfare reform, is a racial and social justice issue. And the act of constant reform is the act of racial and social justice, right? As we see desperate outcomes and we see the overrepresentation of children of color in the system, and we know that the greatest indicator for child welfare involvement is experiencing poverty, we know that changing our system is then an act of racial and social justice. So that's number one, right? So that means that all changes we make have to be housed or couched, whatever the phrase would be, right? In that idea. Dora, you mentioned it as well, that Vermont has the highest number of hotline calls in the country. And so I won't belabor that point, but it is really interesting to consider that such a small state has this high volume of calls, and really discerning what the impact of those high volumes are, right? Is that DCF still has the responsibility to screen every call that they receive twice, right? So you first have centralized intake screening it and then a district screening it. And the amount of time that the number of hotline calls is taking up of DCF, I think, is worth revisiting what our mandated reporter statute says, and changes that we could make in addition to changing training. Um, and I think that also speaks to um, our office's concern about the various ways that families in Vermont are surveilled. And that is a very strong word to use, I recognize. And so I say it intentionally, right? And so I think when we look at the findings of the Child and Family Service Review, what our office has seen in referrals and families and youth that have come to our office for help, um, it's really understanding what the impact of safety planning is on families, the use of alternative caregivers during investigations and assessments without due process protections. And then also, we would hope we could get some more data and information about the use of conditional custody orders by those that are court involved, because that limited data is impacting our ability to fully understand how they are impacting permanency and well-being. Um, I see I have 2 minutes, so I'm almost there, I promise. I think another point to highlight in terms of data, and DCF has provided it to our office, but it is important for this audience to understand the use of emergency staffings for children. And we have seen children as young as 6 years old in a staffing situation, which is sort of a segregated facility or not even a facility, space, without education or peer interaction and limited family contact and no therapeutic treatment and days of rotating staff. And so that is something that it would be wonderful for BBF and OCYFA to partner on to really understand the scope of that practice for the younger population as well. And just to highlight again, Vermont has the oldest child welfare case management system in the country. And that, as Mercedes said prior, a lot of the challenges DCF is facing and the system as a whole is facing could be addressed through implementing a comprehensive child welfare information system, or CWIS. Many of the families we're talking to experience a lot of communication issues. So CWIS is a potential place where we could have communication between DCF and families. They could access services that way, service referral, coordination. Really, it's a way that DCF could build what they need. And we would just emphasize that any creation of a new case management system should be driven by families and children most impacted, and to have their voice at the forefront to really build the system that they need. We've discussed housing, so I think I'll move on from that. And I think one thing we haven't fully connected about was the children, and maybe you did, I think Kitty, you did, mentioning the mental health statuses, but also the disability status of children directly impacts case outcomes. And that has been communicated to us from a very high percentage of referrals to our office. And so parents, schools, providers, and children are saying there are not enough in-home supports, not enough community wraparound supports for children and parents with disabilities. And it has been really troubling to see how there is a lack of accommodation for those children and families in order to achieve permanency or case closure with DCF. And so I'd close to say I noted these specific struggles and highlighted housing, disabilities, or IT, or information technology, and staffing, to really name that the solution cannot all be on DCF or Family Services Division. And so I can't say that enough. And that's not as a former DCF employee, but it's as a child, youth-centered, and family-centered practitioner, really understanding Vermont's system, that it will require all departments at the Agency of Human Services, the Agency of Education, the Agency of Digital Services, the legislature, and the governor to really continue to move the dial as we have started. So I'll stop there.
Wonderful. Thank you, Lauren, for making all those connections for us. Our final panelist, we're going to turn to Lindsay Barron, who joined the role as Director of Policy and Planning at DCF FSD in October. And there she oversees and supports the Policy and Planning Leadership Team, which consists of policy and legislative communications, quality assurance, systems of care team, and practice subject matter experts. So Lindsay, we're going to give the floor to you and allow you to tell us about what you think is working for children and families, and what's key for all of us to know.
Sure. Thank you so much for the time and space. Like others, I'll start by just sharing a little bit of information about myself and how I came to work in this field. I'm originally from Pennsylvania, and I got my education, both my bachelor's and my master's degree in Pennsylvania. And I studied policy analysis and administration. And so I always had some idea that I wanted to end up in a policy making or a policy type of place. However, as I was reflecting on what called me here to this specifically, I go back much further into my childhood. So I grew up as an only child. However, my mom's brother became a part of my family very early on. he had Down syndrome and he had a lot of developmental needs, and that far exceeded what my grandmother was able to provide and care for him day in and day out. And so he became a part of my household. And um, throughout my upbringing, I look back and I see things differently today, doing the work that I do than I may have previously. And, I realized growing up that there was conversations about a daycare that he had attended during business hours. And this was a regulated facility. And there was some abuse that he experienced in that setting. And I think that was the moment that really planted the seed that sort of shaped the entire future of my trajectory and career and where I would ultimately end up. And so I've been with Vermont DCF Family Services for approximately 13, going on 14 years now. Up until the last 2 months, that's primarily been within a policy making and a policy writing type of role. I'm very, very new to the Director of Policy and Planning role, but I think what I'm bringing to it is some of the spirit of collaboration that's been noted already. I have the voices of the family services workforce in the back of my mind, highlighting that, we may be the child protection aspect of the system, but whenever we zoom out and we think about who makes up the child welfare system as a whole, that's all of our community providers. That is our, kinship and natural supports. That's our schools, our mental health providers. That's, early education and child care settings. It's all of the prevention related entities and tools that exist within our community that we need to hold together to care for and support the families and kids that we serve. So I guess now I'll make my slight pivot to what I believe is working well. Actually, in order to prepare for this panel, I put a message out to the whole division that I work within, just querying voices and social workers to speak to what they think is working well for families and children and where they see as the biggest challenges. And a lot of what I was planning to share, their voices really just help to reinforce. And so I want to give some thanks to them. Hands down, what they highlighted and what I agree is our greatest strength is our use of kinship care, our partnering with relatives, family members, fictive kin, really the folks who are known to kids and families prior to us having an open case or us having system involvement in any capacity. Folks are really leaning in to creativity, to how to keep kids connected to their families of origin, thinking through creative strategies of, perhaps a person isn't a placement or isn't a respite option, but what's the connection to their culture, their family history, extracurriculars, and other activities that people known to the child can provide to them. And I think this might come up a little bit in the challenges portion of the discussion, but I think sometimes where things become challenging, it causes us to lean into other areas, which really become our strength. And so I think about our system and how it really hasn't looked the same pre-pandemic as it does post-pandemic. And I don't think that's unique to Vermont. I don't think that's unique even to the United States. I think we see those types of trends internationally where all child welfare systems, all mental health serving agencies, and so on just look drastically different pre-COVID as compared to present day. And so with wait lists being longer or with other system deficits, I think we've really leaned into people and partnership and relationships as a means to support families and do good work. And so a couple examples that were shared with me as some of those strong partnerships that folks feel excited and proud of is our partnership with Lund through our regional partnership program. There's Lund staff that partner with our family services workers to provide some substance use assessment and case management and support. And so that's viewed as a strong strength within our work. Folks also highlighted that substance use treatment providers are offering accessible options for parents working towards reunification. Folks highlighted our child and family support contracts offered through NFI, which had a shout out earlier. So both NFI and Easter Seals provide those services. And folks really shared positive things about, supporting parent-child contact, supporting family finding efforts and connecting folks with their kin, and the facilitation of family-centered and family-led and driven meetings and decision-making. So again, thinking about those settings as not only a means of supporting the case and sort of where we're at, but also sharing decision-making and sharing power with families. Let's see, and then I also just have to note that I think another strength that we are bringing to the table is just the dedication of our workforce. One doesn't typically get into this field or get into this work without something truly driving them and a passion for supporting kids and families. And transitioning into the challenges, I think that some of what was already named is spot on, and I would agree with. Some of the most pressing issues that Vermonters are facing in general, I think we see that in an exacerbated capacity. So all Vermonters experiencing issues related to affordability or economic security, childcare issues, mental health, etc. I think once you have, thinking about where our system becomes involved, when you have an accepted report of abuse or neglect, even thinking about the hierarchy of needs, where if housing is insecure or if there's a substance use disorder in place or domestic violence as a concern and so on and so forth, that just really ramps up the experiences that Vermonters have in general. And so something else that we see as a challenge is a lack of developmental services for children, limited resources for kids with disabilities, long wait lists for autism spectrum disorder evaluations or specialized therapists, and insufficient in-home supports and resources. Also noting that while our network of substance use treatment and access is pretty robust in Vermont, some of the long-term inpatient rehabilitative options are next to non-existent, and that families could probably benefit from some more options there. And then I know I'm right at time or need to wrap up immediately, but just noting, I mentioned this earlier, but some of the wait lists that exists within the mental health system, within other systems and partner agencies, where often it feels like our workers are sort of holding together the coordination of supports and services that often there should be other partners in the community holding with us. And I think the turnover in staff just across agencies makes that really difficult because DCF is often the one system that can't say no. We're always at the table, and despite the caseload or despite how many families we're serving, we're always present. Thank you.
Thank you, Lindsay. Thank you so much. Thank you to all of our panelists. We are going to move into closing remarks, and we just want to remind you that you are invited to enter in the chat your questions and your thoughts.
All right. Thank you all. And a huge thank you to Mercedes, Lauren, and Lindsay. One of the things that Building Bright Futures is really committed to is sharing experiences and the fact that numbers alone can't tell the full story. So in terms of thinking about our panel and thinking about what makes the work real and helps folks understand the needs and challenges of our system, it's so important to have this series of panelists come in and share their time and their expertise with us. So thank you so much.